Right. Good morning, everyone. Welcome back again to our 2019 novel COVID-19 session 8 from TAGB. And thank you all the viewers for standing by. At this time, all viewers are on listen only mode. And before we go further into our discussion into this panel, I would request all the listeners to be in their, just keep yourself mute. So if you'd like to ask a question or anything, please do write right now on the comment box. Please be advised, today's Zoom live call is also being recorded. And if you have any objections, you may disconnect at all time or any time. Thank you very much. To begin with, again, this is again a coronavirus panel and discussion. So coronavirus is not just a tragedy, it's a huge opportunity to build a better world. Now, with the virus pandemic, which is going on, the world is facing, the need for volunteers and community activism is growing. Many individuals and families are, they are without jobs or even without steady income or they're very much unable to find food and other basic needs due to business or school closures and of course, all the store shortages. Not only are nonprofits and community organizations around our nation stepping up, but kind-hearted people who simply want to make a difference are eager to find ways to give back to the community. At a time when the nation is urging everyone to practice social distancing, is volunteering safe? That's a big question. I would say the short answer is yes, as safe as we can make it. Today, we have with us in our Session 8 panel, very much highly dedicated founders, volunteers, coordinators in and around Massachusetts and New Hampshire who are working day in and day out with the vulnerable sectors of our communities. I have the privilege today, thank you very much, Telugu Association of Greater Boston, giving me this opportunity to welcome the caregivers who are giving out mask kits, making hundreds of masks, week by week, others who are packing boxes of food and distributing food to families in need during this COVID pandemic, and organizations who are providing emotional support to grieving families and assisting people in crisis situations, whether they're traveling or living abroad. So without further ado, I would like to introduce everyone in this panel today. We have here with us Jarna Madan. Jarna Madan is a senior interior designer, a project manager, and a TV Asia correspondent in Boston. She's a passionate event planner who is very much involved in several community and charitable organizations in Boston Metro, and who's also, I believe, who is actually in the steering committee member of Hindi Munch. And in 2018, she played, the first Hindi Munch Rashtriya Mahotsav. Correct me, Jarna, if I'm wrong. And Jarna is also a volunteer from Ekal Vidyalay, initiated the Indian art competition for the New England area. I would always say Vajarna is a true believer and follower of the concept of seva and has tried to incorporate that in her life. She has very much clearly shown to all of us that a good volunteer does not work that is asked for them, but a good volunteer identifies opportunities for improvement and acts on them. Welcome, Jarna, and we are so glad that you are here with us.
Thank you so much, Pratima, for that beautiful introduction. Good morning to everybody and everybody who's watching us live. I'm truly honored to be part of a panel with such amazing people, and I look forward to a very interesting discussion. Thank you.
Thank you, Jarna. We have also with us here Julie Noss-Brennan. Julie Brennan is the founder and director of We Do Care Grief and Loss Incorporation, which is based in Easton, Massachusetts. Julie founder, actually, We Do Care is a 513, again, nonprofit organization, which is completely dedicated and empowering the lives of young widows and improving the lives of children who lost their parents by providing them multiple support and resources. During this COVID time, We Do Care organization has stepped up to provide all their members everything they need, right from food, diapers, wipes, all the way to the household items. We Do Care organization offers several resources to those who have outlived, their spouse or partner, regardless of the project or location. Great volunteer like Julie, what she has faced or whatever she faces, she's not afraid to stand up for what she believes in. If something seems inappropriate or unethical, she speaks up. And don't let fear keep her from doing what she's doing right or wrong. Welcome, Julie.
Thank you very much, Pratima. I appreciate it. I'm so excited to be here with such amazing people. So thank you for having me. Good morning, everyone.
Thank you, Jude. We also have here with us from Teammate organization, Mohan Nanapandigaru and Shankar Magapugaru. Mohan Garu is the founder of Teammate 513 again organization, which is incorporated with the fundamental principle of assisting people and families that are affected directly or indirectly by catastrophic incidents, which can be accidents, homicides, suicides, any natural disasters. Teammate is constantly working towards assisting and providing relief to immigrant people in need. Teammate is very responsive team, and best part is that they're very proactive. Mohan Garu, and we are very, very honored to have you here. And Shankar Garu, we are equally honored to have you here.
Good morning. Thank you, Pratima Garu, TAGB, and my fellow panelists. It's a wonderful opportunity for us, and thank you for including us. And we look forward to hearing all other people what are going to say. And thank you.
Thank you, Pratima Garu. Thank you, TAGB, and good morning to all my fellow panelists. Thank you for having us here.
Thank you. Thank you, Shankar Garu, and thank you, Mohan Garu. We also have here with us Padmaja Kunapareddy, who is a software engineer by profession, baker by passion, and she loves being a very active member of our community. She's also a board member of Nashua Public Library, chapter president for, right from this year for New Hampshire Big Help organization, and New England Musketeers team member. Whatever Padmaja does, she does with complete passion, and it's pretty infectious. She's a person who's very reliable and does work with full commitment. Volunteers like her develop solutions to problems that sometimes seems insurmountable. She tries her best to improve situations through creative methodologies, and that, in fact, that hasn't been suggested previously. I'm very proud to have you here today with us, Padmaja.
Yeah, thank you, Pratima. And I feel like, looking at all the panel, such amazing people. What I do is like a very small job, and I'm very eager to learn from all other panel members. Yeah, thank you and good morning.
Thank you, Padmaja. Also, we have here with us Shobha Sharma, who's an executive council agent at New York Life Insurance. She's another amazing, dedicated volunteer who's always eager to take initiative, and she stays humble about her work. She's very competent at the task that she's assigned to. Very much she represents any organization, it's not just one, and takes ownership of the tasks or projects assigned to her. She's a volunteer who maintains very positive attitude and encourages other members of the team. Welcome, Shobha.
Namaste, everyone. I feel so honored. Thank you, Pratima and TAGB, and you all are my inspiration. I see everybody in a panel. I'm so proud to be part of this today. Thank you so much.
Thank you. Also, we have from another member, which very multi-talented person, Pratima Vasiraju, also loves to call her name as PV. She's very multi-talented, and she's from Westwood. Again, by profession, she's a software engineer, having a passion for bringing like-minded people together for all sorts of community service. She's the founder for United Serve Inspire, USI, which is a young charity organization that is started by her this year. And I'm amazed that it is already having 60 volunteers, in fact, strong volunteers. USI's response to despair caused by COVID pandemic, with food drive, and it's benefiting the Merrimack Valley Food Bank. I think the second food drive that their organization is progressing will definitely benefit the Westwood Food Pantry. She's really blessed with highly motivated USI volunteers, and who are also helping her sew masks for frontliners. Thank you very much, Pratima Vasiraju, to come here today.
Thank you so much, Pratima. I'm really very excited to be here, and I can't wait to get the discussion going on all the great things that we can do when we come together as a community. Thank you so much. And I'm very happy to be here representing all the USI volunteers.
Thank you. I'm not sure whether we have yet now with us. Nageshri Chakka is another wonderful volunteer, and everybody, I think most of us know here, who are in the Telugu associations and other associations from Lexington. She's an associate scientist from Biogen, and she's coordinating the entire Lexington team of Massachusetts, almost consisting of, I think, 70 plus volunteers. About her, I think, what can we say? She has a fearless approach. She's a volunteer who can think creatively, very much eager to take initiative, and she has passion and enthusiasm for the cause that she's contributing to. She anticipates what you need and doesn't just, wait to be told what to be done. So we are also very happy to have Nageshri here with us. I'm not sure whether she joined us yet, but she will be here with us soon.
She's here. Pratima.
Oh, she's there. Okay, thank you, Nageshri. Welcome.
Good morning, Pratima. Very kind introduction. Thank you so much. Thank you, TAGB, for providing us a platform to represent our team. I'm so humbled. And thank you, fellow panelists, for working towards helping out our healthcare professionals and the much needy in the society. TAGB members, good morning. It's very nice to see you all on this platform. Thank you, Pratima.
Thank you, Nageshri. So all the volunteers here who I just introduced, they all stick to their commitments. They have a zero flake factor. If they say they will contribute something specific, they do their absolute best to make it happen. So I would probably say they're all problem solvers and tinker and they persist till they find a way forward, in fact. So to begin our conversations, and without further ado, I would like to start the very first question to Jharna. How is your organization helping during this crisis, COVID-19 crisis?
Thanks, Pratima. So I'm part of a couple of initiatives. So if you give me permission, I'll talk about all of them. So I guess when COVID hit us, and none of us were prepared for any of this. And by nature, I'm an extremely restless person. And I needed to do something. I needed to contribute and help because, I think it's our human duty, it's our civic duty to come together and help fix this pandemic that we're all in. So it first started with Manisha Jain, who made a post on Facebook. She was sewing a mask following the guidelines by Emerson Hospital. She needed help with cutting, prepping fabric, and procuring fabric. I don't sew. But I can cut, I can iron, and I can obviously procure fabric. So I reached out to her, and she was very kind enough to kind of create a video for people like me to follow along. And we, with her guidance, we created a WhatsApp group. It became a Facebook group. One by one, we started getting volunteers in who were either cutting or sewing. And just log aate rahe aur karwa banta gaya. We just kept growing, and so blessed to be now having 150 plus volunteers and their families who are equally involved in this entire sewing of masks. And till date, I'm extremely proud to say that we have delivered 7,000 masks to different hospitals and institutes. These masks, let me explain, are 100% cotton fabric masks that are made not for frontliners, but are for the auxiliary staff. But during our process, what we found out was a lot of frontliners were using these masks over the N95 masks to increase the lifespan of their masks. When the masks are delivered to the hospitals, they are sterilized before distribution. Now we're doing the masks, but we've also got a tremendous request for head scrubs for nurses and doctors that we are also now making, and we've completed about over 250 of those right now. And so now we have like two groups focused, one on masks and one on just making the caps. We're hoping that that there will come a point where we will not have these requirements. We're all kind of working towards that. But till the time we keep getting the requirements, our goal is to fulfill all of them. And the motto of our group, which one of our team members, Sumedha, came up with, was Niswat Seva. It's selfless work that we're all doing and as Padmaja said, but it doesn't matter. Every drop in the ocean counts. And, we're all doing our bit. So that's, So We Care is a beautiful family who's, doing all of this. Another initiative that I'm part of is called Care for Janitors. Again, it was a group of 5 of us that were sitting and chatting, and we wanted to do something more. We were all on a Zoom call. We started brainstorming. We spoke to a doctor friend of ours, Dr. Ankit Patel. He was kind enough to guide us. We were trying to do a food drive to go get into the hospitals. And he says, Jana, there are a lot of food that's coming in for the frontliners, the doctors and the nurses, but nobody's thinking about the facilities, the janitors, the environmental staff. He says, those are people who are at the back end of this, they're not coming in front, but they're the ones who are keeping up the hygiene of the hospital, and constantly working and on their feet and at equal risk, just like the frontliners. So five of us got together. We created Care for Janitors. It is we seek for donations, and it's just been 2 weeks that we have launched, and I'm really happy to say that we've delivered over 400 meals to about 15 different hospitals and nursing homes. And our hope is to, as much possible as we can raise, we're going to, we're going to keep doing this as far as possible with the help of the community. And I must say that we're part of such a beautiful New England community. They have come out supporting the causes. So, it's really overwhelming, and I'm so proud to be part of this, and just being on the panel here with so many different people who are doing so much makes me feel very, very blessed. So thank you so much.
Thank you, Jarna.
I would like to also introduce one of the panel member here who's been there in this journey with us for the last 8 weeks. She's Saraswati Mupana. She's a medical practitioner, and she is one of the frontline medical practitioner in this area during this COVID-19. Saraswati, welcome you. We are welcoming you, and thanks for joining here.
Ram, for the kind introduction, and thank you to TAGB for inviting me. And I'm really proud to be on this panel. I feel so humbled to see all that's going on. The community as a whole has come together in this unified effort to fight against COVID-19. And the work is not over. It's going to continue, and the masks are needed, not this year, but the years to follow. So thank you so much for everybody, all the panelists doing all the great work, and teammate as well for doing the most important work to do with the dying phase of life. Thank you.
Thank you, Saras. Over to you, Pratima.
Thank you, Saraswati. I'm glad that you joined this panel too. I didn't know that you will be here. I'm very, very happy that you joined us. And I believe everyone knows, all the speakers and the viewers. Dr. Saraswati Mupana was here with us for all the previous sessions too, and she gave us a lot of information what we needed regarding COVID, all the preventive measures, and the different type of symptoms and the treatments that we had. So we are very happy to have her again today with us. Before I go to the next one, the same question which I asked to Jarna, I would love to ask Mohan Garu. But before that, before even I jump into teammate and ask the same question to Mohan Garu and Shankar Garu, I would love to read a testimonial which we just received from one of the persons from, who got help from teammate. And I would love to read for all the viewers to just, if you can hear me this. Teammate is a team which makes you feel that they are not from outside your family, but they will make sure that they will communicate with you as if you are an extended family. My husband was located in New Jersey, and we all were being in India. And in this COVID world lockdown situation, teammate went beyond expectations and arranged everything in such an outstanding manner that words fall short to express my gratitude towards the entire team. Really, in this worst phase of my life, teammate was a lifesaver and helped us in the best possible manner. I had a chance to arrange everything sitting back in India with the help of teammate. Thank you so much for each and every piece of arrangement and making this whole cremation a lifetime memory. This is by one of the person I want to keep anonymous, but this is amazing. These are the type of testimonials that teammate keeps on getting. This clearly shows that Mohan Garu and other volunteers, dedicated volunteers in teammate, they always take sound judgment. Especially, I've seen like Mohan Garu, because I myself is one of the volunteers for teammate, and they have, in fact, he has the ability to sift through alternatives, deliberate, and then arrive at a sound decision. He has seen the bright picture, but is able also to implement plans effectively to move the organization forward. So coming back, Mohan Garu, this is the question back, same question which I asked Jarna, back to you, like what is teammate as an organization doing its best to help during this COVID crisis?
Thank you, Pratima Garu, and thank you, everyone. Teammate, let me briefly give an introduction of what Teammate does. Probably most of other people may not know. We're a nonprofit organization. It's a non-faith, non-religion, non-language-based organization. We incorporated only about 3 years ago. Now we have spread in over 25 countries across the globe, and we have over 2,000 volunteers just US and Canada alone. And unlike many other organizations, and we are not a proactive organization, I would say we do about 20% proactive, but 80% is reactive. And whether it's COVID related or non-COVID related, people are not really prepared for an unexpected catastrophic incidents. It could be a death, it could be an accident, it could be a sudden sickness or something. So we have been doing that for the last 2 years, over helping maybe 600-700 cases alone. And with the COVID situation, it has become really difficult. Sorry to take a little longer. You read a beautiful testimonial. This is a really, really heartening incident. A 33-year-old employee of a big multinational firm found dead in his apartment, and it's presumed as a COVID death. It's just only 33-year-old. His wife is in India. Everybody is in India with the COVID situation, and nobody could help anything. And if you call any funeral homes in entire New Jersey, New York, people are not ready to take, even if they take a COVID death, it's taking about at least like 4 to 5 weeks to arrange a cremation. So we did everything less than a week. And we not only did, and a lot of these funeral homes not even opening a COVID body. So we nicely got him dressed up and created a video streaming to the parents across the globe, and over 200 people, like all his friends, his colleagues and employees, watched all over. And we did at least a decent, goodbye to him. And, the wife actually, unbelievable, even though she was in such a grief, she called and she wanted to volunteer for Team Aid. So make it short. What we do is, just help people. We become their extended families in these kind of situations and help them. And just last 8 or 9 weeks alone, we did at least 30, death incidents. And we help people across the country, and anywhere from Sacramento, California to Portland, Maine. And this week alone, Ramakrishna Garu helped one case, and Srinivas Garu and Shankar Garu helped like 2 other cases. Right now, we have 6 deaths. Around 2:30, there is a funeral going on. There is, when time comes, and I'll tell you, there is one more tragic incident happened in New Jersey. So Team Aid, that's what we do. And now actually we become more active because there's a lot more need, whether it's a COVID death, it's non-COVID death. A lot of parents coming from India are dying, and there's unfortunate situations. They can't even go back to India. We cannot even send their mortal remains back to India. So we're helping the families to cope up the situation and get on their feet. So thank you, Pratima Garu.
Thank you, Mohan Garu.
Pratima, just to add, right? So the COVID threw a big challenge to Team Aid, what we are trying to do in terms of how the process has changed. So that is what one thing we learned and we are trying to deal with in the cremation, as Mohan Garu pointed out, right? There are challenges for the number of people to visit, how to perform the rituals, etc. So the other alternative is taking advantage of the technology to get that satisfaction for their loved ones to say a formal goodbye.
Absolutely. Yeah. Thank you very much, Shankar Garu and Mohan Garu, for sharing, all the points about Team Aid. There's so much to know about it. And I would be requesting all the viewers after this panel of discussions, please go into each of these organizations and read more about it, what they do and how you could also help them. The same question is again for Julie. Thanks for being here again, Julie. Could you please tell to all our viewers, what is your organization about and how are you helping during this COVID crisis?
Sure, thank you, Pratima. So my name is Julie Brennan. I am the director and founder of We Do Care. We Do Care, you can think of as widow care. So today happens to be National Widows Day here in America. So it's fitting that you're asking me to be on your panel. Thank you very much. I first want to say thank you to everyone that's already spoken about the efforts that you're doing. It touches my heart tremendously to see that, number one, there's people that are helping the people that are on the front line, and maybe on the front line, but they seem at the end of the line. As far as the janitors, the cleaners, the helpers in those respects, which is amazing. My husband, Tom Brennan, actually is a paramedic here in Brockton, Massachusetts. Brockton, Mass is the #1 COVID cases in our state. So 50 hours a week, he is on the front lines. And I truly appreciate everyone that's honoring those frontline workers that are risking their health and their lives by going out there. So thank you. We Do Care. You can find us at wedocare.org. We are a widow organization. We help young widows, young widowers, and children that lost a mom or a dad. So we are based here in Easton, Massachusetts. We started out as a teeny tiny idea of care packages for women and men that were widowed at a very young age, as well as care packages to give to children who lost their mother or their father. When that idea came about 9 years ago, it kind of transitioned into much more than just care packages. However, the mission behind We Do Care is to support, to empower, and to provide community resources to our members. So when the Corona days were starting, about 7 weeks ago, when we were all told that we had to stay home, we had 20 active members. We now have 36 adults that we are serving on a regular basis. With those 36 children, or 36 adults, are 78 children that we are regularly trying our best to feed, to clothe in some cases, to put diapers and wipes in the homes of those babies. Our main mission right now for Corona Days is to keep the surviving parent that is there raising their children on their own, to keep them healthy. So in order for us to keep them healthy, we need to keep them home. Our efforts have stepped up in that every 2 weeks, we are doing we call it a drive up. So it's Corona Drive Up Days. It's right in front of my house in Easton. We are serving upwards of 35, 36 families. They literally drive up in front of my house. They form a line as if they were in a fast food restaurant. And we make sure we have our masks. We make sure we have our gloves. We are keeping ourselves safe. We're doing it every 2 weeks on a Wednesday. We just did our third one. And we are fortunate enough that we have been able to provide a tremendous amount of food to the families. So for the last 2 drive-ups, we provided $170 worth of groceries. That was luckily that we were able to get that from a connection with my brother's keeper. However, they did just tell us this week that they are unable to provide us with food in 2 weeks. So we are on a mission to figure out if we can get connected to the Boston Food Bank and to other local organizations that can help us provide food, because if our surviving parent in the members that we serve, if they get sick, who's going to take care of them? Who's going to take care of their kids? So it is our mission to provide the children with art bags. Part of our program is expressive arts, so that our children can use their creativity and put their grief and loss into art. So we have been securing donations and using our fundraising money to provide art supplies, so that while our kids are at home 24/7, they are doing some useful things like using their creativity and trying to alleviate their stress and anxiety as well.
Right. Thank you very much, Julie. You're doing amazing, amazing job. Can't even express how much hard work you're putting into all these things. I'll be glad if you could also add about and write a little more about your video care, and just also post for the viewers to know, because we are in the Zoom call. So in the comment box or on the chat, if you can just put the website so people can also see that.
Okay.
Also, this will go for everyone, for all of the organizations too. This question, the same thing, which I'm again moving to Padmaja Kunaprede. Could you please again tell to all our viewers what are your organization, of course, for New England Musketeers, trying to do for COVID-19 crisis?
Sure, Pratima, thank you. Before I talk about New England Musketeers, I do want to be a testimonial for Team Aid. Mohan Garu must be wondering how I'm talking about Team Aid. 2018 or 19 in New Hampshire, there was a death. A kid from AP, Andhra Pradesh, from Telugu state. So he died. And again, I'm going to be emotional. I saw how Team Aid participates. Like everything was moving so fast, getting from body to all the way to New York and flying the body back home. I was like, oh my gosh, I was really impressed. And that's when I said, okay, I will join the Team Aid. So yeah, thanks to you, Mohan Garu. Anyway, moving on to New England Musketeer. So I went to India. I came back March 3rd, I believe. And I was watching news, CNN. And then and I was wondering, how can I help? What should I do? I really want to do something. So that's when, I think March 20th, I got a call from my friend and state rep, Lata Mangipuri, asking, can we stitch 15 masks for Southern New Hampshire? A couple of nurses or doctors, I believe. Then I posted in WhatsApp to my friends asking who is interested, because I don't stitch. Then I got 6 people immediately saying that I will do it. The very first day, I think I drove up to Lexington to Nagashri's house to drop the kit. So I copied the idea of I don't know, you guys might have heard Joanne Fabrics were doing do your own kit, face mask kit. So I copied their idea and then like created like face mask kit. So that way, when I give a kit to is a seamster, like, stitching person, they should be able to make 15 masks out of that without much cutting or everything. So the very first couple of days I was driving around, and I'm so blessed and happy that now our team is like 60 plus team members, and all our volunteers are all like wearing multiple hats, right? They're moms, like working, taking care of kids, teaching kids, online schooling and everything. On top of it, like I see the interest coming, like how many masks I should do, like so to the date we did around like 3,000 face masks, and we delivered to pretty much mostly New Hampshire area, like southern New Hampshire, and also Army Reserve, Gateway Community, nursing homes. And just yesterday, this is one thing I want to do was like a grocery stores. You might have heard a death from Salem, Massachusetts. A grocery employee died. So I know we should also focus on like hospitals and everything, but we were asking Lata, how can we help? So that's when United Way of Greater Nashua reached out to us the other day, saying that there's a food drive going, and Shaw's, Market Basket, all those employees will be there. Then we can hand out so they were like 600 face masks or something. So yeah, I mean, that's how the whole thing started, and that's how it's going right now. And being a software like an engineer as a professional manager, so I immediately put together a process that I have to have a process implemented. So now we have like 4 to 5 groups. One group is dedicated for like driving. So I'm so happy that Karthik Shah is leading that. I used to lead who is going to drive, we need to schedule, right? Like when we can go drop the kit, when we get the face mask back home. And also at the same time, I don't want our volunteers to get sick by not following social distancing, right? So that's why we made sure whoever is stitching and cutting fabric, they shouldn't come out, they should stay home, and only 1%, 2% driving around get it. So we have like around 10 people driving around now, volunteers, and Karthik, Gautam, and a couple more people. And also we have a fabric cutting group. Their role is to cut the fabric and make into kits. And then of course we have like a 30 or 40 people stitching. And also I have a group on how can we improve face mask. I think Sarna was talking about we used to make plain mask, then we have a pocket. I do have my mask here, so we do have a pocket here where they can keep a filter, which is more efficient. I think Saraswati can attest to that. We are using 3M filters, furnace filters. So I have a group who researches how can I make it comfortable. I was wearing one day and the elastic was a bit hurting my ear. So I have a group who can redesign and how we can make it improve. And of course I have a group on the core side, which is how do we get funds. For example, we're raising money through United Way of Greater Nashua, Rotary Club, and also American Indian United Community in New Hampshire. So their responsibility is to, of course we do need fabric, we do need material, threads and needles, right? So that's how we're gathering money and material, needed material. So yeah, I mean that's our journey. And again, like Saraswati said, I think I do get questioned when are we going to stop, when when the need is will be done. So I get the same answer from Lata and other people that it's going to take a while. It's going to take a while. So yeah.
Thank you, Padmaja. That's a lot of information. And actually joining with the same organization, how you are doing a likewise like that is what even I think the Lexington group and Nagashri can also explain to us about how they're, it's more than an organization. How are Nagashri, are you thinking you're making a difference as a team, Lexington team during this pandemic, and what is keeping your entire team motivated?
Thank you, Pratima, for the question. I just called for a set of volunteers thinking that why not we help out the needy in the community. When I joined Padmaja's group, I was so inspired. I was one of those first to put up the hand to say, okay, I'll volunteer to stitch. But I was so inspired by this group. I was driven to start our own group in Lexington. My prime focus was to reach out to nursing homes, shelters, senior centers, disability centers. These are the facilities which get resources on a second, third, or fourth phase. Most of the facilities goes to healthcare professionals, so that I kept the prime focus on those less resourced centers. So I called for volunteers in Lexington, and I was amazed. Within 24 hours, I had more than 40 volunteers who came forward to form a group, and all of them were strangers to me. They were just empathetic and driven and passionate, and they really want to serve the needy. They are so passionate that the whole family is sitting together and they can stitch 100 masks within 2 days. It was mind blowing. The word of mouth spread fast, and the funds and the resources coming in. We made more than 3,300 masks so far. We made more than 325 scrub caps so far. We donated more than 600 disposable scrub caps and other PPEs. We are working on, the younger generation are working on the crochet bands and the 3D printed mask securers. Even younger ones are working on greeting cards, thank you cards, and thank you notes to all those professionals who are putting their life out, risking their life out there to keep us all safe. This team has been simply amazing. I wouldn't say how is the team motivated. I would say how my team is motivating me. It's outstanding the way they want to give back. Each one is a professional in a highly demanding job, work from home, having kids, home tutoring, keeping their fitness on, and above and beyond, stretching to give back to the community. I can't thank my team enough for giving me this honor to coordinate and represent them today. Thank you, Pratima.
Thank you, Nagesh. That was wonderful. Shobha, coming back to you on the same grounds, I know you are doing for Seva organization. Could you please tell us what is Seva organization and you as a person trying to help during this COVID crisis?
Thank you so much, Pratima. It's like a story, very small story started. Me and Nisha Sinha, we both are from Seva Volunteer. And one day, I have some family members in healthcare professional. So I quickly find out our health system is falling apart. They are like running out of masks. So we both talk about let's do something about it. And then we started to talk to, because it's related to healthcare professionals. So Dr. Sarvaji, we called, and that's how we started this project. First, Seva 7 volunteers started, and then I'm part of Hubtown Legacy Volunteer Group here I live in Hopkinton. So I put in a group we are planning to do this from Seva, and they joined right away. So next day I have 15 ladies. So in that way, slowly I'm very active in social media. So I have almost 4,000 people in my friends. So that helped me a lot. So once I posted, within a week, we start making around 200, 300 masks. And I'm very transparent person. I post everything in a Facebook. Everybody know, whatever I make, I just try to post in a Facebook. So slowly people start connecting with me in a Facebook Messenger, and then friends. That's how I get a lot of people. So now total, if you ask me, we have 78 volunteers helping us. And I'm not counting kids and husbands. I don't count that because they are helping, but the ladies total we have counted 78 so far. And we have all Padmajaji said, there are some are dead right now, so they are trying to help us with this, and some are retired physicians, and some are other IT professional and other. Around 5,000 masks. And by grace of God, I'm so thankful to each and every one of you, and each and life. This is life. So I want to thank everyone. Is so encouraging, so encouraging. From only the beginning, I think we bought almost $100 fabric and elastic. That's it. From that day, we have not put penny for our fabric or elastic. Everything is from generous donation. Even today, I already made 2 rounds of getting elastic and a fabric. So people are amazing. I get a lot of donations. So that's how the we don't have to worry about much supplies. And so from Seva International, we have distributed N95 around 300 masks to the frontliners, and KN95 500 we have already distributed. And we have we just got shipment of 5,000 3-ply masks. So we are in a process of distribution right now. So, mostly like somebody told right now, I just don't want to focus in frontline. Yes, we have to, everybody, that's our first, but I think prevention is better than cure. So what I see, like, I see Whole Food have one family, I don't know the person, she just reached me out through Messenger. Like, I work in Whole Food, they won't allow us to wear masks. Like, they don't give us masks. I have young kids, so please help me. So, anonymous, I'm not even posting those things in a, I just want to protect. That's our main goal, to protect everyone. So hospitals, our main focus is hospitals and senior centers, nursing home, and groceries also, like the Spice and Hot and other groceries places we have distributed. So fire department, police department, health department. And yesterday I was seeing interview of police, Hopkinton Police Department. He was infected before I gave him a mask. So, and like a Boston Children's Hospital. So mostly we have distributed 20, almost we have distributed 20 hospitals so far, like Metro West and Worcester Recovery Center, they are, and then Whitler Rehabilitation Center. These are more hit. So every week we try to provide them 100 to 50 mask, fabric mask, on top of what we have extra, like N95 surgical. Those are the added one. Another thing I really want to thank our seniors is more my, I'm very motivated from them. Neela auntie, Mridula auntie, Saveri, she's physician, still she's helping us. They are seniors and they are very excited more than me, and like that makes me so proud. Like, I'm doing a small effort, what they are doing right now. And I really like Neela auntie. She do so perfect plates and everything, and she pack, and she will call me. So we have a delivery. I have, like, thank you, Padmaja. I cannot forget you. You are the one first. I created a group, and I was like, I knew she just started that time, I think. And I want to get some idea, like how to maintain the quality, what I supposed to do, and how to create a program. So Padmaja helped me out in the beginning. She helped me a lot. Thank you. And I'm very conscious about the like quality. So till now, though we have distributed almost 5,000, every time I deliver boxes, I make sure I will ask how I always take feedback. How was quality? What do you think? What we should improve? So now, I think because of that, we have kind of relation build up right now with nurses and doctors there. They call and they start asking me, can you make a gown? Can you make a cap? So now we added that venture. Like, now we started a cap and a gown, and we got a face shield from one Nandishji and Heather. So we are getting a face shield and earpiece. So now whenever a hospital asks me, can you give me a mask, cap, gowns, face shield? So I try to pack in one box so I can send it to them right away. That's how we started. And most important thing is safety, because of this, because the situation, like I said, there are young kids are involved. There are very young kids, and we have seniors. So we have to be very careful about, how we handle the fabric, how we deliver to the hospital. That's my main focus. So basically, I am controlling everything. I'm saying controlling because I know maybe, like, I'm not letting everybody handle fabric right away. So what I do when I get fabrics, we put our gloves, we put a mask, and we put in a proper plastic bags. And we have a delivery team. They will deliver the fabric to the families. We don't want volunteers to come in and out all the time, because we have 78 volunteers right now, and some have health issues. So we deliver to their house, and when delivery person deliver, they will message me that it's delivered. Then I call the person to pick up, and I always give clear instruction. You have to put the gloves, put in a washer. Though it's washed, I want them to wash again. So I want them to wash, and then there are like cutting department. A couple of people are doing cutting, and I have stitching. So I have divided the group. So whoever cut it's ready, then again the delivery person will go and pick up. So we are trying to, and then once everything comes back here, I will pack in a box, and I'll make sure this goes to the right person. That's another thing.
I'm sorry to interrupt because we have less time. So I would like to ask questions to others, but thank you so much, Shobha. You're given so much information for now. We'll be awesome, Shova. If you could also remember, because we are in Zoom, on the comment section, if you could put a little bit information too about how Seva organization, your organization does for everyone, so that people can actually get back to you if they need more questions, so that, because we have less time, we need to ask. Sorry to interrupt you for now. Sorry so much. Pratima Vasiraju, this is for you. You just started the United Serve, and before I ask a question about that, how are you making a difference during this pandemic? And again, I know that, starting any food bank or anything, so responsibilities get overwhelming, not little, literally we're too much overwhelming. And when you cannot get everything on your to-do list. So how are you keeping about with that too, Pratima?
Thank you, Pratima, and thank you once again for including me. It's just great discussions. It's so nice to hear different perspectives. For Unite, Serve, Inspire. So we are a fairly young organization, but our 16 volunteer strong group. We have several years of experience doing community service. That's what brings us together. So that's where the like-mindedness comes. So we've been friends for a long time. And then once you incorporate community service into the mix, it brings out that drive and passion. So we started this year and started thinking, how is it that we can make a difference? And then COVID-19 hit us hard. So we started talking through what is it that we can do to give back. We are one of the fortunate people who can do something, who can make a difference. So we started reading about all these food banks, how there are people who are living paycheck to paycheck, they're not able to feed their families because they are out of a job, or they are in that situation where they cannot be employed. So we started thinking of food banks, and Merrimack Valley Food Bank really stood out because it's a much larger food bank, which is able to distribute to local food pantries. So that really caught our eye, and we thought, okay, let's get together and do something. And it's so basic, and the thought of a family with children going without food, it just hit us hard. So we started this first food drive, which was very successful. We were able to collect not only non-perishable items and personal care items, but also a lot of cash donation came in, which is it's again a good thing, because there were quite a few people who had concerns about safety. How is it that we can drop off some of these non-perishable items while being safe? So we gave them that option of making cash donations, which resonated well with a lot of our contributors. So we were able to do that. And then it's a highly driven group of people. We wanted to do more. Then Sudha Molpur, she introduced us and got us connected to TAGB. Thank you so much, Sudha Molpur and TAGB. We are on to our next food drive. So we didn't take much of a break. We are on to our next food drive. And this time it's more local to us, the Westwood Food Pantry. The reason being that we did get a message sent out from the Westwood Food Pantry coordinator saying that there are so many needy families in our town, and we are not able to provide food to them. So that's how the second food drive came about. So it's in progress. So if anybody would like to donate, please contact us. We are on Facebook, Unite, Serve, Inspire. And I also wanted to talk a little bit about how we're not happy with just doing one thing. Radhika Goli, who is also a volunteer, USI volunteer, she had posted a message on our WhatsApp group saying that, hey, there is this group called New England Musketeers who's looking for people who can sew masks. And then the response was quite amazing. There were a lot of people in our USI volunteer group who can sew. I can't sew to save my life. So I do a lot of fabric cutting. So it shows that we are a small group, but we are driven, we are enthusiastic, we are passionate. We want to do what we can, especially in times like this, when and also there are so many different ways that one can help. So that's pretty much where the volunteers, that's our thought process and how we want to contribute. I just wanted to talk a little bit about the name Unite, Serve, Inspire, because it's very meaningful to us. Unite because we're like-minded people coming together. We want to give back to the community. We want to serve the community. We have that in us that, and we do think that we are fortunate enough that we are able to do things for the less fortunate. And then inspiration, it's a big piece of what we do. We inspire each other, we bounce ideas. So our WhatsApp group is very active. We bounce a lot of ideas. So what are we going to do next? How can we help each other? It's a very positive group. And also we would like to inspire our youth. I have 2 daughters, and it gives me a lot of happiness when they say, Mom, you're doing such great things. We want to help too. So they sometimes help with the flyers, however they can help. So we want to also include our youth and get them to join us and be a part of what we do.
Absolutely. Thank you very much, Pratima.
So, Pratima, I would like to take a minute or two here
Sure.
on the. This is one of the reasons that we had this initiative of bringing in all the volunteers into this whole COVID-19 series, because everyone is doing their best part as a kind of a singular unit, but it plays a major role when everybody comes together and start offering help to each other. It's not that one volunteer organization is self-sufficient to take care of the services on its own, but having a neighbor next to you is so much helpful for such kind of large initiatives. When we come together and when we know that the neighbor or the fellow volunteer needs help, it gives immense strength to the efforts what we are already putting into. And at the same time, like teammate, what they're doing, nobody may expect until one faces that situation, right? The food, the masks, we are all taking the preventive and the necessary steps, but when such incident hits, that's where really we need to start looking out for something that we did not expect at all. So at any point of time, having such organizations known to us or that we are aware of, it will help the services that we're providing to the next level. And as a segue, I just want to take a few seconds of time from Saraswati Garu. Saraswati, you have listened to every volunteer here, and as a practitioner, what do you think what do you think there is something missing, or that you are looking for something more from volunteer organizations already providing such kind of stupendous services here?
Question. I feel everybody is doing phenomenal. Think it's humanity is being questioned right now by this COVID-19 virus, and I feel we are being resilient, we are being strong, and as a community, different aspects, everybody is trying to do what they can do, and that's amazing. And just look at our panelists itself. Everybody is trying to think outside the box and see what can they do, how they can help the community, starting from starting to make the mask, getting creative about it. And even though we don't have, each one of us don't have all the skills, like I don't think I can sew, but we don't have all the skills, but we are putting things together, bringing it into perspective, and see how the community as a whole can come together and get the feeling that they are being helpful in this pandemic. They are contributing in some way or the other, starting from the kids to the seniors. I think that's so important. Even the parents who are there at home, give them a little responsibility, or not, the responsibility is not the right word, but give them, okay, put these in packages, something like that. They feel there's so much involved. They would really remember this for a long, long time. Getting the kids involved, as all of you are doing, as Showa was also mentioning, getting the kids involved, and every organization seems to be having not just themselves doing the work, but also getting everybody in the community involved, all different age groups being involved. So all of us should feel that at the end of the day, this is the most satisfying thing we are able to do, and give back to the community as a whole. That's one thing. And not, it's the mass helping each other. And as I mentioned earlier, the masks are going to be here for a long time to stay. Not this year, maybe next year also we'll start needing the mask, just like the Japanese do. In the flu season, Japanese people are wearing a mask just to prevent themselves getting the disease, right? So maybe this masks are going to be here for a long time to stay. So that's one important thing. And while you're doing the stitching the masks and giving it to the people, which is amazing, masks have extended to the caps, and then the eye shields, the 3D printing of the eye shields, and the kids are being involved in that task as well. And the gowns, I'm amazed to hear that even now the gowns are also important when we're walking into a patient's room. I think I might reach out to one of you to ask for some donations for the gowns and the surgical mask myself. So those things are important, but what I would suggest is, yes, everybody is following the CDC guidelines, and Joanne, as somebody was mentioning, Joanne Fabrics have made this goal of 1 million masks, and they were able to go beyond that. So they have the do-it-yourself projects and the integrity. Also giving a little cheat sheet when you're donating. Maybe you can just give a little cheat sheet saying how to take care of the mask, or whatever you're giving, the surgical caps or anything. Just saying how to take care of it, just making sure that you wash it before you use it. That's one way. Putting it in the washing machine, that's the best way. There have been a lot of controversy regarding whether sunlight, the heat and humidity can kill the viruses which are on the clothes. Okay, but we don't have any long-term studies proving that. So I would suggest for now putting it in the washing machine, because we know the disinfectants and the bleach and the alcohol is going to take care of the fat globule, which is there on the virus, and inactivate it. So that we know is proven helpful, and it'll take care of the virus. So that's something I would strongly suggest. And putting it in sunlight too. But as I said, we don't have any long-term studies to say that in sunlight will help kill the virus. The most important and effective method for now is the alcohol and the bleach, which will help. That's one thing. And thank you for everybody to doing the food donations as well. I think that's amazing, and it's so touching to hear all the stories. And my passion and my heart, being an intensivist, and I see people dying in the ICU, it moves a lot to see how compassionate we have to be, and how, especially during this challenging time, when you can't even go into the patient's room or the intensive care room, the family members, because of the restrictions of the COVID-19 pandemic, they have a lot of restrictions to go and hold their loved one's hand during the dying phase of life. And everybody, as a human being, we all want to die with grace and with dignity. And I really respect Teammate for doing all that, helping the families and helping the patients to go through that in a very calm and peaceful way. I think I'm really humbled to hear about all the work that's going on. So my thing is mainly taking care of the mask and all the clothing, mainly precautions. If they can add a small cheat sheet and put it when you're donating you can't do it in every mask, but maybe put it on your website, cares to take care of the mask, so the mask integrity is not lost, and also giving instructions on how to clean it and how many times they can use it. So those will be helpful. The CDC has their own website also to do with the mask. That will be helpful too. So I think I want to stop here. Thank you so much for all that everybody's doing.
Thank you, Saraswat. But I think we have the next question for Mohan Garu and Vicharna. I'm going to start with Mohan Garu. COVID-19 is, we all know, is representing virtually all organizations with unforeseen challenges. What has been the most challenging part of, part of navigating COVID-19 for your organization or as a team? So is your organization ready to meet them?
I'm sorry. Yeah. Sorry for that. Okay. Of course, we are ready. Not just now. We're always ready to cope up with any situation and deal with any situation. And I don't want to give an impression that Teammate is just dealing with only with the deaths. In fact, our volunteers across the globe, and particularly across USA, we're doing a lot more than just dealing with the deaths. Our volunteers are traveling to the homes and giving food and supplies. We have collaborated with a network of doctors, providing prescriptions for the families, particularly parents coming from India. And we're providing food and shelters, people the students and travelers who got stuck, including Ramakrishna Garu did one last week. And we're dealing with those. And particularly with the COVID-19 situation, dealing with the death, as Dr. Saraswati Garu just said, it's really heartening, when especially the person is dying in front of you and you can't even touch if it is on your own family member. It's really tough. And the same situation if somebody die and we want to see them for the last time in their life, and we cannot. So that's why we are using technology. And even though COVID deaths, we did at least like 30 funerals within the last 2 months, and most of them COVID related. And we're doing at the best. We're risking, the funeral homes are risking their lives, and the funeral directors risking their lives, and the volunteers are risking their lives. Yet we're doing at the best we can do. And at least they can virtually, or we can see either the Zoom call or the video call, they can see and say their last rites to their beloved ones. So that's what we're doing right now. And I would proudly say there are about 8,000 nonprofit organizations incorporated by non-resident Indians just alone in America. The TMAID is the only one exclusively incorporated to deal with kind of catastrophic situations. And we're dealing it very efficiently, thanks to our volunteers, thanks to our national team leading Shankar Garu and Krishna Garu is part of them, and Pratima Garu, of course, we are there, and a lot of our volunteers. We coordinate, we answer 24/7. And not only just dealing or giving an advice, we're providing legal advice, where a lot of domestic violence cases coming to us. And particularly with the COVID-19 situation, one case I will tell you, if it is not a COVID death, but actually it's indirectly related to COVID death. If you look at the news media, there's the Jersey City, there's an young couple, the great achievers, an IIT grad and a Columbia postgrad, and he was having an excellent job, and wife is a very renowned person. And the COVID-19 situation, they were kind of stuck home, and they got in some financial troubles. And sorry, I cannot disclose, but according to the news, which is already published, they're presumed it's a kind of a suicide murder, and it's tough. So we got to prepare not only with the COVID, and there will be a lot of hunger deaths, a lot of domestic violences will go up. And one funeral director I'm talking to in West Coast, this week alone, he dealt like 7 suicides. So a lot of suicides may come up with the frustrations and the habits that they're going through. So those things, we need to be prepared. So we are counseling, and we have a lot of our volunteers that are experienced people that are giving counseling. Plus, we are kind of a extended family for those people who are affected. Sometimes just giving an advice. If you don't mind, I'll take 1 more minute. There's one situation going right now, right in Boston, and she's a doctor, a renowned doctor, came from India, ovarian cancer, and she's going through the treatment in Brigham Women's Hospital. Unfortunately, she was in stage 4, and she couldn't go to India. And we have been talking in our volunteers on a regular basis. We are talking to the family every day, her daughter and her son-in-law, and she wanted to go back to India. She doesn't want to die. And unfortunately, with the lockdown situation, it's tough. And you see people crying on the other side, and you need to have patience. You need to answer, even though they're not your family members. You need to be like their own family member, or maybe their best friend. Answer them. Unfortunately, she took her last breath yesterday afternoon, and she died. And immediately we jump in, and we're doing everything possibly we could do. We were doing the best to arrange a local cremation with all the Hindu Indian rituals, and the best thing we can do to prevent our dignity and say the last rites. So that's all we're doing. So we're ready for just any kind of situations, and particularly with this COVID.
Absolutely. Thank you, Mohan Garu. I mean, this is way beyond, and I think may her soul rest in peace. It's because all the viewers are here today, and you can see how much TMAID organization is really going way and beyond to help these type of situations, which is going. And this is how, when a question comes, the easy organization ready to meet, that's where it comes, like taking the prompt step, like how Mohan Garu just explained, like it doesn't need to be happening just today. It can happen any moment, and you need to be prompt enough to just jump in and do the action right there. So thank you so much, TMAID, on the whole, doing so much work. The same thing is for Najarna, because I know that it's a little overwhelming for everyone, right? For seeing some side, you all must be finding some sort of unforeseen challenges. So what has been the most challenging part when you are trying to navigate with your organization?
So I don't know if we truly have faced, because following what Mohan just said, I mean, TMAID comes across the situations where they they're handling that the back end funerals and just counseling and all. And for us, we've obviously created two groups, individuals, one creating mass, one's, sorry, I'm a little choked up after hearing Mohan speak about teammates. So, my heartfelt gratitude to you and your team for everything that you do. And so to Julie also, because I think people like Julie and Mohan, are right at the end where they're helping families and counseling them and just, sharing that grief, which is so important. I think the biggest challenge I think we're all facing together as a society is like that mental stress that everybody goes through, either just hearing all of these stories or stuff like that, because so we care and care for janitors, we're maintaining that social distance protocol, we're not risking anything by ourselves or by our volunteers in order to either make the mask or deliver the masks or deliver the food. We're kind of within the social distance parameters we're working on. And we've created like a camaraderie. We have two beautiful families going that mentally support each other, like the group of women, especially in the So We Care. If somebody has one little issue, 10 of us jump in. Somebody's needle broke, somebody's machine broke, it's a whole camaraderie and family. I think COVID has just extended, like it's made our families much bigger. And I'm also very honored to be part of an organization called Hindi Manch, which, what we're doing on Hindi Manch is actually giving people a mental break. We are hosting free events every Saturday. It's either music or poetry or kids related, just to get the families together and give them a little break, little entertainment. So that's our way of giving back to them, so that, because we all need that break. And right now with the social distancing, we are stuck to Zoom. That's our life right now. So however possible, we're kind of doing what we can. We're also trying to maintain the mental health and give a little break to people. So that's, Fatima, from my side of, how things are going here.
Absolutely. Yeah. And coming back to Julie, because Julie's already here and they're doing so much for the widows. How is, your organization helping? Because at this pandemic, it causes a lot of loneliness epidemic too. So how do you think you're handling all that?
Good question. So we jumped in 7 weeks ago, and I am a doer, feet first, get it done, whatever needs to be done. So we have a few volunteers that are helping me do our efforts. It is our mission to make sure, as I said earlier, that our men and women that are at home and they're the surviving spouse that are taking care of their children, it is our mission to make sure they stay safe and healthy. So their emotional support, doing Zooms. Last weekend we did a Princess and Prince Zoom party for the kids, which was adorable. We got Belle from Disney to show up in our Zoom, and it was the real deal. She was a princess and she showed up. We had tea and cookies, and everyone was in their houses safe, and all the little girls and boys were dressed up. We had 10 different families show up. It was adorable. But I come from a family of service, and I know that it's just important. It's a pleasure and it's an honor for me to be able to serve our people. So we empower our people first off by, instead of calling them widows, they know when they wake up every morning that they're widows. We call them warriors. So they are warriors that stand strong, and they stand on both of their feet. And we make sure that we help them from the foundation. We encourage them. I tend to try to be a cheerleader to as many as I can, but then I also enlist other people to be cheerleaders. So we did a Mother's Day effort. The American holiday Mother's Day is May 10th this year. So it's a week from today. We were fortunate enough, I had a friend who hand wrote 33 cards of encouragement that went in little packages. So those were sent home with everyone that came last Wednesday to our drive up. We still have a few more to deliver. So we have special surprises for the children for Mother's Day that lost their mom. We have 4 families that they are sadly going through their first Mother's Day, the American holiday, without their mother. So we are making sure that those children are taken care of. We bought their dads a special little gift that we'll be sure that they get before next Sunday. We also, our next biggest drive that is very, very important to me is for Father's Day, which is an American holiday. So that coming up in June, we will make sure that usually we have an event where we actually get the kids together. Last year, we took the children out to eat, and they got to have a video game card. Unfortunately, we won't be able to do something cool in person, but we will honor their father that passed away, and we will honor their loss by coming together like this on Zoom, and also providing art supplies. So our community out here in Massachusetts has been really great, especially in Easton, Massachusetts, in providing us with items we need. We are not trying to get our donors sick, so we are asking people to even look around their house for art supplies, things that they have. Maybe it's a bead kit that was half used, or maybe it's something children got in your household. Maybe they got 2 for a birthday gift, but we're asking people to kind of leave things out, and we can get a volunteer to pick it up. I went out this morning picking up items. I was out yesterday picking up items. People are super kind, and they're kind enough to come to my drop-in at my house, which we appreciate. But it's the little teeny tiny things I think everyone on this panel understands. It's really just someone that doesn't know you, that cares, and makes an effort to send you a card or to think of you in the tiniest way. It's not about material things. It's about just caring and giving a care.
But Julie, adding to this same question, like, and how does your organization communicate consistently, and clearly, because so many people that don't know, they get confused too, as information is constantly merging.
Okay, so which information do you mean on how to keep
relating now presently with the COVID, right?
Okay, so we've had Zooms where we've tried to encourage. I am someone that posts on social media. My husband's a paramedic, so I take guidance from him. And we're just trying to make our people aware that the children also need to wear their masks, because it isn't just the adults. The kids should also be wearing it so we don't transmit, right? We don't transmit corona to each other. But most importantly, we're really supposed to be staying home as much as we can, and keeping those kids out of the hospitals, keeping the kids out of the grocery stores, which are germ factories. So really just spreading the things that we're hearing and coming down. And what some people think is common sense isn't common to all. And if you don't have someone on the front lines to help you, like doctors and the paramedics and the people that actually know, this is brand new to all of us. We're all trying to get through it as best we can, right?
Absolutely.
Sorry, Pratma. So we are just a little over an hour. We have a Q&A session for the guests who are participating in this Zoom call. And even I would encourage any of us, because everyone has some or the other question, to reach out to the fellow organization. So we can start, Pratma, with the Q&A session, and then move forward to getting the Q&A questions from our guests here.
So do we have anyone who is there asking any questions?
Right now, we would like to open this forum first to our panelists if they have any questions with the fellow organizations, and thereafter move forward with the questions from our participants on the Zoom call.
I have a question, actually. This is Padma. So in terms of challenges, so one challenge I was watching is recently, because we've been doing for 4 weeks. And again, none of us has experience in stitching, and they're all software engineers, something else, right? And a couple of people are maybe this was Saraswati, are complaining about back pain or neck pain because they're cutting the fabric for a couple of hours stitching. So that's the one challenge. I mean, I wouldn't say challenge, but I'm telling them, don't stress yourself. This is a volunteer work, right? They have primary jobs, so don't stress yourself out. So that's one challenge. So I was wondering if any of other groups had this kind of challenge, or how are you dealing it? This is for my group who is stitching and cutting the fabric.
So, but I think we've been telling people always to take break. Health first. You guys need to keep yourself healthy before you guys can help. So, and as you have a assembly line, so do we, and I'm pretty sure Shova has the same thing. We have designated people who are just cutting and ironing and just sewing. So for at least for us, we've told our sewers, you are not going to cut and iron at all. That's up to us, because we have a team of 150, and only 30 of them sew. So, and then every time we're just we get together on Zoom calls, we take a break, we lighten the WhatsApp conversations. Our biggest thing is, please, everybody has to stay healthy first. I think that is the first civic and moral duty that everybody, I think all of us have to, is we have to keep ourselves healthy first, and then do your family stuff, then go out and do whatever, not go out per se, but just then go do it. Balance life out, because yes, we are indoors, and we're making the best of it. But once definitely self-care is, I think, the most important. And, Dr. Saraswati will kind of attest more to that, how important that is. So that's all we're doing. We're just making sure that everybody gets a break and just stay positive, stay happy, give your, it's okay to put up your feet and stop sewing, stop ironing. So
Mohan Garu has some questions.
Yeah. First of all, I want to thank every one of you. No matter whether you're doing a small task or we're doing a big thing, it's equally good. I mean, everybody has a heart to do something for the others. That's a nice thing to have. And at the same time, let's use our resources together. And every organization is trying to do something on their own, and it's excellent. At the same time, we can use our resources to benefit others. So, for example, we have volunteers across the country. And particularly in the Massachusetts alone, we have more than 200 volunteers. Literally every town we have volunteers. So if you need something, they're delivering fabric, or maybe delivering or transporting these finished goods from one place to other place, please reach us and go to teammate.org, and you can put a request that need help. And then our volunteers, will communicate, and we definitely ask one of our volunteers to do the job. So once again, thank you all for the wonderful things you're doing.
Also, I have a question for all the organizations who are actually making masks, because this is coming from some of the people I know. Like when the state reopens now in Massachusetts, so many centers, whether they are childcare centers or any other provider centers, they'll be looking for multiple safety and hygiene products, which are all in short supply, right, in the current market, which can include masks, can include face shields, gloves, liquid and gel hand sanitizers. So will all this be, I mean, even they would be able to pay at a certain price and a donation to the organizations. So will the organizations be, kind enough? Are you thinking about it to even help them with PPEs, these type of organizations? I mean, this goes to everyone, whether it's Padmaja, Nageshri, Shoa, Jarna, because who are all into right now making into, the masks and making masks.
Yeah, that's a good question. I've been thinking also, Pratima, about this one. So particularly, New England Musketeers are pretty, like right now we're doing only face masks and then going into gowns. But I'm kind of very lucky enough that we have United Way of Greater Nashua. So I can definitely, Liz and Mike are the director and the president of the group, and they've been donating quite a few stuff in New Hampshire area, pretty much, right? What you just mentioned about the groceries also, right? Not just the PPEs and so my group is not, I shouldn't say our group is not doing it, but United Way of Greater Nashua and Rotary Club are the ones that are doing it. But if there is anyone that that need this kind of stuff, then I can definitely connect you guys with United Way of Greater Nashua. And also, I just want, because I'm off mute, I just wanted to mention that this is for Julie Brannon and anyone. So for my group, Pratima knows this. I love baking, and I enjoy baking a lot. That's all my stress relief. If you guys need for your people any baking stuff, call me. I'm happy to do cupcakes or And Julie, especially my father passed away when you're very young, and what you are doing is personally and I wish we had that kind of. So my mom had that kind of help. So again, I think what Mohan Garu was saying, that how we all can help each other from this group. I really want to hang on to this group, and then maybe more people, see how we can help each other. From my side, I'll be very happy bake good good for you guys.
Mohan Garu, and yeah.
Can I take a few
please.
seconds to
Please.
just answer one's question? The previous about the COVID fatigue, there's a new terminology called COVID fatigue. That's mainly people who are helping to take care of all the patients and also issues, right? This is a term in the health industry now, COVID fatigue, which is burnout in the healthcare providers. And we have so much of digital media, which is coming out at us, learning so many new things in a very short time, and we are trying to help so many people at the same time as well. So I want everybody to be aware of the COVID-19 fatigue, and please make sure that when you're delegating things to your teams, please make sure you rotate them. Not everybody gets the brunt, and you want to make it sustainable, because now is the pandemic, but the aftermath of the pandemic is going to be there, right, for a long time, till our health economy and everything else settles down and people would need, as Mohan Garu was also mentioning, it's going to be a long-term project. So kindly do keep that into mind, keep that in mind, and make sure that you all are rotating the teams. So not one person is getting burnt out in the whole process. And please make sure you stay healthy. That's the most important thing. The person who is sewing and has the neck pain and other pains, it could be because they're sitting in one position and being so focused on the task that they're doing that they forget that the muscle can cramp. So it's really important to take breaks, and every either 90-minute break or once in an hour or 2 hour break definitely has to be kept in mind as well. And also thinking positive. I was listening to Sister Shivani from Brahma Kumaris the other day, and she was saying how important it is for all of us to think about the positive things, the patients who have recovered, how many people are benefiting from this, and just feel good about yourself for all the services that you're doing for the community. I think that is also so important. I'm not saying that we have to feel proud or anything, but just it's a positive energy, just getting the positive vibe so you can bring out the best of yourself. So that's something I wanted to stress.
Well said, Saraswati. I'm a firm believer in teamwork. I mean, at least everything can be done alone, but once you have a companion, things are much easier and much more right whatever you do. And I have a question for Julia here. What is the process you are following to accept donations, unopened or lightly used toys from stationary items for education?
Great question. So we don't have a lot of storage. So what we try to do is any donations that come in that we could give to the family right away. Number one, we're asking for new. Just because of Corona days, it would be easier to take new right now. Number two, if you look on our Facebook page, we have our next drive up events will be May 13th, and then 2 weeks from there, May 27th. So if you have some wonderful things to donate, we would appreciate that. Unless it's for a different situation like the Father's Day, we typically are just trying to get our supplies to our people every 2 weeks. So May 13th, May 27th. So you could get in touch with me. My email is Julie, JULIE, for Brennan, at wedocare.org. So Julie B at wedocare.org. Or you could send us a message on our Facebook page for We Do Care. In that way, we could have a volunteer pick up, or we could give you our address so that you know where you could send it. We are based in Easton, Massachusetts. So we would be grateful and thankful for anything that people choose to donate that could help our families. So thank you.
Thank you, Julie. Over to you, Pratima.
Yeah. This is a good question for, again, Mohan Garu. What do you see the long-term strategy for fighting this COVID? And do you feel that, or it will adequately prepare us for the next, if eventually, if the situation arises like this?
I mean, of course, one positive thing I see from the entire pandemic is people are uniting. If you look at the organizations coming forward, the governments coming forward, we're all united and working together to a common goal, fighting this. And a lot of research going on across the globe, and definitely they were hoping that some vaccine or medication is going to come soon. I think the one already is got a express approval. Hopefully that's going to work. And apart from that, I think, as I said, I'm not an economist, but a lot of people are saying there's a lot more to deal with. And just not only the deaths or the disease or the sickness, but we need to deal with other side effects, the losing jobs. When I have 30 million people losing jobs, how it's going to affect the economy and how the domestic violences are going to go up. And we need to be very careful, and especially the listeners, and I'm suggesting to be very calm and patient, deal with this situation. And not only you deal with your own, and if anybody you come across, try to see, how you can help them or how can at least calm them down. That's more important. And the mindset is going to change. The businesses are suffering, and we're going to live in a different world, right after the pandemic is closed, over, and people are still in a panic mode, and we're in a fear. until now, we don't have that kind of fear. We're a kind of free birds. But now, going forward, whether we're going to go get close to the people, we're going to go to the public places, how the sports industry going to do, how the tourism going to do, there's all going to affect. And particularly, the groups right now, and a majority of the people who are in this group right now are all like, I would say majority of them are like immigrants. And we have a lot more challenges than anybody else. What if somebody on a H-1B lose a job, and how is going to cope up with this situation? So those things, we need to deal with. So a lot more to do. I mean, we will learn, and I definitely, very positive. One good thing is this COVID-19, we don't have any physical loss. It's not like a tsunami in Japan. It's not like a Katrina in Louisiana. And we don't have any physical loss. It's kind of in a mindset, and we will rebound. Definitely, the entire world is fighting back, so we will rebound. So just ride with the wave.
So Mohan Garu, this will be again for everyone in this panel, just 2 lines or in 2 sentences, if each of you could say, what are the key lessons that each of you have learned in this process? Starting with Mohan Garu. Yeah.
Oh, you want me to start with again? Okay. Thank you for giving me a lot more time than anybody else. Lessons we learned right now is how to deal with these unexpected situations, and especially when you're confined to your home, confined to a small place, how to live with it, and how to live simple, and how to live with the things that you really don't need to have. And that's actually goes back to our ancient history, and that's a good thing to have. Now we're spending a lot of time with the families, and we understand what our children needs and what the other people need. That's what we learn. It's definitely a great lesson. And we're saving the environment. That's a positive sign. The animals are coming to the streets. That's a positive thing. So definitely this is how we made the life very complicated because of the things available. Now with the pandemic, we're learning things to do in a simple way. So we buy what we need. We live, how simple and easy. That's my take. Thank you.
Thank you. Julie, what are the key lessons that you have learned in this entire process?
I've learned what I already know. So love. It's all about love. The foundation of our being is about loving and caring. And unfortunately in America, a lot of Americans are entitled and selfish people. And unfortunately, we needed a wake-up call. So I think in other countries, they might be able to say this too. I know that as a traveling American, I know that they're very, very kind to us as tourists, but they also understand that as Americans, we need to be educated on a lot of things. And we think that we're the smartest, when in reality, the basic need that all humans have is love and connection. So we need to be connected. We need to love. It doesn't cost any money to love on someone. So to share our talents, to share our intelligence, to share what we have, to not judge, to just care just because you want to care. I just feel like educating, empowering, spreading awareness to the important causes, but reminding people we're humans first. We need to love and we need to care for other people with less judgment.
Absolutely. Jharna, your thoughts?
Julie, you said it right, and Mohan also, you said it right. I think what it has taught us is that there is no difference between us. We are all humans. Doesn't matter what caste, what religion, what country. We've all been affected the same way, and we're all going to come out of this hopefully as a very strong and more sensible race. I think I just want to make a shout out to all the youth and all our children out there who have so beautifully and seamlessly adapted to this entire change and that we have gone through. They've gone into online schooling, online classes, and they still have their smiles on their faces. So, to everybody, stay happy, stay positive, and we'll all get through this together. Thank you.
Thank you. Is it Nagashri? Any thoughts? What are your lessons that you learned in this process of COVID?
If the virus hits us hard, we can hit it harder. Look out for each other. Compassion. Coexistence is the lesson taught by virus to us. Stay together. Look out for each other. Yes, we can beat it. Thank you all, the panel, for watching. Continue doing this, continue influencing the people in the community to do this. Be what you are. Thank you all.
And Pratima Vasiraju?
Pratima has been too silent in this call.
No, I would definitely, if I had time, I have a lot of questions, but I don't know because time is always constrained here. I have a lot of questions for everyone because I'm always full of questions. But if you have time, I do have, Pratima, you there, right? So
yes, I am.
So what do you think? I mean, a very quick question for you. What changes do you need to make for your organizations when it comes to procedures and support resources?
In terms of procedures, so for us, we've focused on the food drives. Again, what is it that we can do to get food on the table for needy families? So for us, the challenge has been, of course, the safety aspect of it.
Yes.
Folks, when they want to drop off any non-perishables, there are some concerns that they will have to come to our driveway and be dropping things off. And how is it that we can keep our volunteers safe? So that has been a big concern for us, but it's not something that we are not able to solve. So we do, when some items get donated, we make sure that they're disinfected before we drop it off at the food bank. And what we've done with the latest, our current food drive for the Westwood Food Pantry is that we've offered curbside pickup. So if somebody's a little nervous about driving to places and would rather stay at home, which we respect. So we've said, some of our volunteers have come up and said, we can do it. We can just drive in and around town and pick up the non-perishables. So if there's a problem, we can always brainstorm and come up with a solution. So that is a challenge that we are facing. And again, cash donations is the best way to go if there are safety concerns. I do want to deviate a little bit and answer about the lessons learned.
Yes.
So I am a strong believer that magic happens when communities come together. And that's what we are seeing in this pandemic. So it's just unbelievable that even people that we don't know, for example, they've seen a flyer and they are donating. They know that the USI is doing something, or there's some other organization doing something good. So people are not really thinking too much when it comes to giving back. So that's something really, all the goodness in people is manifested in the way they are donating and the way they're giving their time or they're contributing.
Thank you.
I feel so wonderful listening on to the wonderful, I would say my favorite words. One, positivity, said by Mohan. One, coexistence, said by Nagasri. One, love from Julie. From Be Together, togetherness from Jana and Pratima. So wonderful to hear this. And this is one of the main objective of having this call. I know we have already eaten away 90 minutes of your time, but there is so much to go.
I have to give a last note, Rama. If still we have a time, I do want to give a last note to all our volunteers who are here.
Yeah, we'll go there. And I just take 2 minutes from there. I believe there are some questions from the other participants not on this panel. I would like to see if anybody has any question. Please go ahead and unmute your mics and then please ask.
And I have one thing just to tell, right? So we were all talking about all these great things and what we are trying to do and to help each other and help the communities. Most of us may not be knowing this. Rama is also a fellow volunteer with us in Teammate. Mohan Garu always preached us, Teammate is a flat organization. We are all volunteers. But Rama also is the current president of Telugu Association of Greater Boston, who helped to bring all of us together. Kudos to him and thanks to TAGB for all your selfless service that you are doing across the New England region.
Thank you, Shankar. Yeah, we'll open up the questions from the other guests on the panel.
I have one question for Dr. Saraswati.
Sure.
I have always have a question about the hospital protocols, about the PPE, how that there is a stock with them, but they are not able to open it to the actual people who are treating to the COVID patients, and that's how the nurses and the doctors who are treating the COVID patients directly, they are always facing the shortage. And then when we call up the hospital has a protocol. Oh, we have a way to get the donations, and when we donated and when we contact the nurses and the doctors, they have actually not got it. So what is the scenario with that part? I know there are restrictions, I know that you have to make it available to a lot of people, but why is it stuck in the donation area, and why such protocols in the time of COVID, you know?
So usually what happens is, thank you for this question. Usually what happens is in any corporate hospitals, they want to make sure anything which is just not now, even from before, even if the patient brings a device from the home, they want to make sure this it's not faulty, it's working well, because the hospital is liable, right? That's the norm. They want to go through the check with all the protocols and policies in place within the hospital system. So they know exactly what they're using, and they know how to control the situation. And if it is from outside, they do not know what the settings are or what the device can do, or if there's any device malfunction. So that's even before COVID. But now, given the COVID situation and to do with the PPE part of it, the hospitals have their supplies, and when they're running out of supplies, the hospital directly has a commission or a committee where they can get the donations from, or they can accept the donations. So if you talk about my hospital right here in Beth Israel, I'm talking about at Milton location. So they have the food pantry where we could go and donate previously, and say we are donating and give a cash or a check to the food, the chain. You have to give it through a proper chain, a committee member. And then they'll order the food. So it's coming safely. They know exactly what they're ordering, what is the precautions taken by the restaurant, and how they want it. They can give all the terms and make sure it's safely brought to the hospital, so no hospital employees or the patients don't get sick, or the people who are handling it don't get sick. So I'm giving you an example. That's the protocol. So to do with the PPE part of it, you please contact the committee member who's the incidental command officer for the COVID-19 team. They'll be able to tell you exactly what the hospital protocol is or the policy is for accepting the donations. And they might actually, whatever mask you're giving, if it's going to be a cloth mask or something, they might put it through their sterilizing process and then distribute it. I'm just saying mask as an example. It could be gowns, it could be surgical caps, it could be anything. And they have a process making sure they want everybody to be safe. That's the whole intent. That's why they have these policies in place. So there is a COVID-19 incidental command task team for every institution, every hospital. So you can contact one of them or email them. And if you need any help in contacting the hospital which you plan to donate to, just reach out to me. I'm on Facebook, and Ram can also share my email ID with you all, and I'm happy to help.
Thank you. Appreciate it.
Thank you.
So Pratima, over to you for any closing comments. Thank you all. It's a Sunday afternoon already. It's lunchtime. Everybody might.
Before I go back to thank you, Rama. Before I go back to the closing sentence for everyone, I would like to end here and just ask one common question. Definitely, Mohan Gaur is the best person here to guide all of us. What do you think are the bright spots that have you seen for your team as a result of COVID-19?
Oh gosh, that's actually a tough question. It's not as simple as you
That's
think.
why I didn't ask anyone, because you're the perfect person here to answer this.
Yeah. It's actually a test case. There's a bright spot for our volunteers is to rise up himself or herself to prove that he can actually deal with this situation. And our philosophy is, if you look at our teammate website, our philosophy itself is, we rise to help others. And that's our philosophy. And this is actually the bright side for our people to rise up themselves. So for example, Ramakrishna Garu will say, he went, there's a student got stuck, and she's a J1 visa, and she got supposed to go back to India with the flight situation. She got stuck. And he went and, basically he drove her from one place to other place and putting in a hotel, and we're providing shelter and food. And that itself is a risk. Basically, he traveled with an unknown person in a car for a few miles. That's a risk. So the bright side is the challenges that we come across, and we rise to the situation, and that proves that we can take the risk, and we're for others. So that's kind of inspiring. And not only him, we have a whole group of people in New Jersey. They're traveling to the homes and delivering foods and food supplies, medications, and you name it. and the same thing, the funeral homes. So, these are the things, this is a bright spot right now is how to help others and how to cope up with the current situation for ourselves. So that's, I think.
Thank you, Mohan Garu. And I would like to really thank all the volunteers who are here today for all you do for your involvement. I think it's so privileged to see everyone work with our region's most caring, community-minded, and I can say generous volunteers. I'm myself a volunteer, so together we will keep each other's spirits up and use this time to learn new ways to care for and support each other and our planet. Myself, none of us don't know when that will be or when, what normal will look like, but we want to, we all need to point out for the organizations and volunteers that are chipping in to help. While our government has been struggling and they're administrating tests and getting enough supplies for healthcare workers, all these organizations, whether it is Team-Aid or Ekal Vidyalay or Seva organizations, and you name all the different organizations, so Telugu Association of Greater Boston, IAGB, everybody coming together, they've directly bought resources to bear on the front lines, donated proceeds and supplies, or helped prioritize especially vulnerable customers. If any of the organization today, all the viewers who are present, if you feel that, if there is any organization that need to be given more focus to, so that we take as our TAGB organization to spend more time, please do send us an email. Please do send to TAGB at covid19@tagb.org, so that they can be included in the next interview. I would like to, on behalf of Telugu Association of Greater Boston and other partner organizations that we have, which is a Team-Aid, IAGB, we have Boston NATS, the NATS, Boston chapter NATS. Then also we have the BVIS. I'm just taking the privilege from all of them because all these organizations have come together again under one common umbrella, and they're rigorously working hard to make sure that everyone, they have a common goal, the joint efforts to combat COVID-19. So I think the best part to end or not to end, it's like, it's very hard to say, what the volunteers are doing and what they're not doing. It's very hard to explain them. As I told last time, right in the beginning, that volunteers are worth their weight in gold. That's the only best way I can end it here. Is there anything else, Rama, you want to add here?
Yeah, I definitely want to add. And once again, thank you all. Thank you all for taking time on Sunday. And it's very, very informative. I heard few of my favorite words here in this call. And let us do what we're doing. And nonetheless, I would like to thank Surinder, who is behind this, technically helping out to make this go live, across all platforms. He's invisible here, but he's very much there right from 10 o'clock to the morning. And also to the Sravio, who is enabling this pass on to the audience. And please keep waiting for more sessions. Next week is going to be an interesting session, which will be for youngsters, the youth and teens. And you might have gotten used to our faces, but next event will be organized solely by teens, all the students who are going through a different challenge at this point of time, coping up with COVID-19 with their classes or with their spending time in the house across these devices and with the family, which they are not used to. So we will hear some interesting comments from youngsters in the next call. And I hope you all participate, and please let everybody in your communities know that we are trying to do as much as possible to keep everybody engaged and come together and be involved with the community. And once again, thank you all. Have a good day.
Thank you.
Thank you. Thank you so much.
Thank you.
Stay safe.
Thank you. Yeah, bye-bye.
Thank you, everyone.